I've been practicing as a periodontist for over 20 years. Really, we're in the long haul with patients. We're looking to manage their inflammatory disease really through their life, okay, once they've been diagnosed. The perio patch fits into that treatment scheme very nicely. It's readily accepted by patients, readily accepted by other members of the dental team, by dental hygienists. This is something that you can just easily add on to what you're standardly doing, whether it's scaling root planing, whether it's maintenance therapy, and really the overall goal is to get that inflammation under control. Easy application, easy acceptance by patients, and what I'm seeing is really a very nice reduction in inflammation. By all means, I'm usually reapplying during regular maintenance visits, whether it's every 3 or 4 months, or let's say at alternating intervals. But this gives an option to patients to get the inflammation under control, because that's what's most important. If patients are going to retain their teeth, again, the evidence indicates that if we control the inflammation, by all means, they're going to be stable long term. Well, my career as a clinical investigator has been built around adjunctive therapies. I've worked with local minocycline over the years, with doxycycline and chlorhexidine. This is a next step. I mean, it allows the patient to reapply. It's all very safe and readily acceptable. So I see a little bit of flexibility with the system and also reliable results, basically what we're looking for. Patients accept this. You can coach them on where to apply the patch, and in terms of acceptance and compliance, I'm seeing no problems with that at all. And again, my usual protocol is to recall that patient at 2 or 3 month intervals to really check to see how that lesion has resolved. There's some flexibility. Again, the label for the perio patch is pretty broad. It includes not only periodontal disease or periodontitis, but other oral lesions or wounds, including lacerations or even peri-implantitis, or canker sores, for instance. So it has a very broad label, again, for inflamed lesions of the oral cavity. Again, as a periodontist, I can see the benefit in my patients, whether it's at the front end with scaling and root planing or in maintenance protocols. Well, there is a companion mouth rinse, Peri-Active, that has the same botanicals, active botanicals that are anti-inflammatory. I've coupled that with patients with some good success. Again, there's no contraindications for other over-the-counter products or prescription items like chlorhexidine. But again, there's some additional benefit of using the paired mouth rinse from the Izun portfolio.